everyone. My name is Harleen Kindola from the team Empower. I'm accompanied alongside with my teammates Jenny, Renata, Tatiana, and Linda. I would like to explain the general rundown of our presentation. It will be presented as followed. Introduction, explaining the issues that lie within this topic, the barriers, our goals, and our solutions to these issues and barriers. Of the healthcare system where we thought a change could be implemented is the management and regulation of answering phone calls in all settings of the healthcare system. It's an obvious fact when we think of calling a hospital or a clinic and being put on hold for an extensive amount of time, and it can become quite frustrating. Oftentimes, missed phone calls or dropped calls are overlooked in all places of work. When a patient is concerned about some sort of ailment, their first instinct may be to call their primary care clinic to get an opinion or some advice. When a patient is unable to get in touch with someone at the clinic to receive some sort of help, this can cause a state of panic. Patient satisfaction decreases and some situations prove detrimental, and the overall experience proves to become a negative patient-provider interaction. Management can take steps to ensure tasks towards specific staff to answer the phone line to ensure no call is missed, whether it is during the hours of operations or after hours. Also, there should be steps taken during patient phone calls to ensure if a call is dropped, a callback number was noted. Effective communication between all members involved in working with the telephone line would be important. My team members and I have come up with a management plan and the leadership skills learned throughout this course that can ensure a lasting change within the healthcare system.
Hi, I'm Linda, and I will be discussing the issues of the change management project for our group, Empower. Working in a fast-paced outpatient clinic setting, processes and workflows have to run efficiently to keep up with the demands. Our project is based on an outpatient clinic whose phone answering process is suboptimal, causing several issues, including missed and dropped calls, delays in relaying messages, phone call screening by front desk staff, and decreased patient satisfaction. The first issue faced in this environment is the large number of incoming calls from patients and the inability to answer all of these calls with the current system in place. Without having a voicemail set up for patients to leave detailed messages or having a phone with multiple lines, phone calls may be missed. Staff may be preoccupied and unable to answer the phone as they may be with another patient or involved in another task. Patients may not be able to get through on the phone, causing calls to be dropped. A second issue is the delay in the relaying of messages. Due to the busy setting of the outpatient clinic, staff are constantly involved in several tasks, sometimes all at once. When messages are taken by staff members, there can be a delay in getting those messages to the appropriate staff because they may not be available to receive the message for extended periods of time. With the fast-paced environment, messages may get lost in the mix. If the messages are not written down or noted somewhere, the staff who took the call may forget to relay the information. If the message is jotted down on paper, it may get misplaced or forgotten. A third issue is the screening of incoming phone calls by the appropriate staff. Front desk staff are very helpful in taking phone calls and answering questions within their scope of knowledge, but often patients call and need medical advice or have a question that may relate to another department within the clinic. Front desk staff may be unfamiliar with the inner workings of these other departments due to the complex structure of the outpatient clinic, which may house many subspecialties and departments. In the current system, front desk staff often take messages that are given to the appropriate staff, but this increases the amount of phone calls that are placed because patients are unable to speak directly to someone who is properly trained to answer their questions due to the busy workflow of the clinic. This also creates more work for the clinic staff and reduces efficiency because more time is spent on the phone calling patients back. If patients are unable to answer when the staff members call back, This causes even more phone calls to be placed. A fourth and possibly the most important issue is that patients become dissatisfied with healthcare services provided by the clinic. Given that a staggering 81% of consumers were dissatisfied with their healthcare experiences in a survey conducted by Profit and GE Healthcare Camden Group, it is important that the clinic make the necessary efforts to improve the patient experience. Patients can become frustrated with having to place multiple phone calls in an attempt to reach clinic staff members. If a message is not passed on or delayed in getting to the appropriate staff members, it can create an unpleasant experience for the patient. Being placed on hold for extended periods can also be frustrating if patients are having to wait long periods of time to speak to clinic staff. Missed calls can also create a delay in patient care. If patients are unable to get through on the phone, they are unable to schedule important follow-up appointments or have questions answered about their care in a timely manner, which may have a significant negative impact on the patient's health. By identifying issues with the phone services provided to patients, we can make changes that promote patient care and the quality of service provided over the phone.
Hi, my name is Jenny, and I'll be talking about the barriers. So, there are many reasons why a call can be dropped in the healthcare setting, and this could be due to extreme cell traffic. Some calls may be dropped because there's so many different numbers calling into one central line that a call may be dropped. Also, due to the user demand and number of employees. So sometimes the amount of calls you can get in your clinic or company can be more than the number of employees to pick up the phone call. So this will cause there to be a backup or a waiting time for the patients to call in and ask questions and concerns. Another barrier could be carrier frequency. So depending on the carrier you have, calls can get through faster or slower. Also, signal strength. Sometimes due to the weather, it could affect the signal strength. If there is, say, a snowstorm, calls may not get through at all. So that could be a barrier. Other possible barriers for dropped or missed phone calls are the hours of operation. So some clinics may be open only on Monday through Friday, and then they'll be open 24 hours over the weekend. Or some may be only open Monday through Friday. They don't take phone calls at all over the weekend. Another barrier could be the average weekly volume. Some days are more busy than other days. Some days could be slower. So, say during Monday through Wednesdays, it's your slow days, and then Wednesdays through Fridays, it will be, a higher volume compared to earlier on in the week because people tend to call over the weekend because they are off work or they'll tend to drive in their car and call the clinics during their free time. So the weekly volume could have an effect on the dropped amount of calls. Another barrier may be the average handle time. So different patients have different questions and concerns. So a lot of times there is a different way to handle each case. So say you call in and someone needs to know the procedures and what type of insurance they have. The call could take longer on some, and it varies on other calls because some of the calls may be shorter and some of the calls may be longer. So it's hard to pinpoint an average time. Another barrier could be the abandonment rate. So a lot of times patient calls tend to drop because patients don't want to wait on the other side of the line. They will most often hang up and then call again if they're put on a waiting list, or they can call another clinic because they don't want to have to wait or they don't have enough time. Other barriers that could be a problem for missed calls may include inadequate communication between the staff. So for dropped calls, it's important for a team to have awareness about the communication. So in Dye's book, it says In an effective team, members are always aware of each other's roles and responsibilities, as well as the team's purpose and standards and goals. So you need to know the goals that you have to set. Say handling front desk calls, you have to keep them timed, professional, and you have to know that everyone's concerns and calls may be different. Another problem may be organizational complexity. So decision making for the patient, a lot of times patients don't know what they need or what they want or the services the clinic or company provides. So you have to call in and ask, and a lot of the times the front desks have to be educated on that. So you have to make sure you're educated so it won't become a barrier. Another barrier may be pressure due to deadlines. So sometimes the deadlines, different clinics have different deadlines. So say you have to answer all of the phone calls before you do your tasks or answer phone calls last. It depends on your clinic. Another barrier may be poor interpersonal skills. This means that the patient, may not be satisfied with speaking with the caller they have on the phone line. So this could be due to lack of knowledge, not being able to speak clearly or directly to the patient. So the patient could possibly hang up and call again and potentially get a different member on the line.
Hi, my name is Renata. I'll be covering the goals portion of this presentation. It's important to set clear goals when coming up with goals. Our goals are relevant to the issues mentioned earlier. The goal of addressing these issues are not only to improve phone calls in the outpatient primary care setting, but to also increase patient satisfaction. Healthcare has become a booming industry with improved technology and having more accessible ways for patients to contact their clinic. One of those ways patients can connect with us is using the phone system. The first goal is to reduce call abandonment rate. A missed call is a missed opportunity to help a patient. In the outpatient primary care setting, we also want to eliminate the lost calls by providing cell phone boosters. Those boosters include either having faster Wi-Fi or having wireless connecting devices. Another goal is to improve efficacy, such as coming up with a more effective phone answering service, such as an automated system, which allows the patient the option for a callback without losing their place in line. Secondly, we want to increase the effectiveness of workflow by implementing an improved phone system to increase the number of phone calls processed by staff members of the clinic. We also want to increase patient satisfaction rate by addressing patients' complaints about multiple transfers of being stuck on hold for more than 5 minutes. By addressing these issues, patients feel they are being heard and that measures are being taken to fix that. Improving the system will also save the clinic time and money. Not only is it important to consider the patients, but it is also important to consider the healthcare staff. Our goal is to reduce stress and frustration levels of the healthcare personnel. Having the trained staff to pick up the phones and training the staff in active listening, phone etiquette, and aware of the difficulties they interact with will reduce the stress and frustrations of talking to patients over the phone. Lastly, our goal is to push for better communication between the patient and the provider. In the primary care setting, we want to avoid provider-centered communication and focus on a patient-centered communication. Clear communication addresses main concerns in the clinic, and patients understand treatment plans clearly, which would decrease the need for unnecessary phone calls.
Hi, my name is Tatiana, and today I'm going to be talking about solutions, possible solutions. As you already learned, our main goal is to reduce call abandonment rate. According to research from Valera, all it takes is waiting on hold for 1 minute, and 60% of customers will hang up. That is why it is very important before you implement any solution is to start with your KPIs, key performance indicators. Call detail reports should provide you with all necessary documentation and information. Answering questions such as how long a patient waits until hanging up, how many calls per hour per day, when is the highest volume, what type of calls your clinic receiving. You can make informed decisions as to how to resolve the situation. Like so many technologies today, Automated phone system is the balancing act between increasing convenience for your patients and saving money. When considering all the options, it is important to keep in mind your patients' perspectives. In a perfect world, your clinic would always have enough people to handle the number of incoming calls, right? Right. However, this isn't realistic in a typical clinic setting. We are hearing a lot that doing more with less becoming a trend in our industry. Implementing automated phone tree might cost your practice upfront, but will save money and increase patient satisfaction in the long run. Developing efficient phone tree menu is also important. Based on your practice needs, a phone tree menu can include hours of operation and fax numbers, schedule, cancel appointment, refill or referral, and clinical questions. Spikes in call volume can and will occur in any practice. Usually the result of those is a poor customer service experience. To avoid this impression, make sure to staff your clinic based on the volume. If hold times are an issue, consider placing automated message on how long the caller might wait and maybe giving the options to leave a message. Some phone systems offering a callback solution as alternative to hold times. Another possible solution that your practice might consider is the implementation of the patient portal. Patient portal implementation improves quality of care and increases patient satisfaction. Patient can use portal to schedule appointments, contact their care team via email, and get the response the same day. Request prescription refills, request a referral, pay the bill, and view their lab results online. By providing another option to contact your practice other than a phone, will potentially decrease your abandonment rate. After your practice found the perfect solution to a challenge that you are facing, don't forget about important step. Follow-up. To sustain results that were achieved during the process improvement, make sure to continue to produce weekly reports. And don't forget to share them with your team, because it's a team effort. Provide feedback to your staff. And remember, every call has a revenue potential. This will conclude our presentation. I hope you enjoyed it. Thank you so much for listening and have a wonderful day.